Good morning, everyone. Today's lecture topic is on gingival inflammation. Now, as we know that gingival inflammation is defined as an observable alteration in the tissues associated with the changes in vascular permeability and dilation, often with the infiltration of the leukocytes into affected tissues. These changes result in erythema, edema, heat, pain, and loss of function, which are all the cardinal signs of inflammation. The sequence of events culminating in clinically apparent gingivitis is categorized into initial, early, established, and with periodontitis designated as the advanced stage. Now, what's the pathology of gingivitis? It's first microorganisms attached to the tooth surface of the gingival sulcus. These organisms start synthesizing collagenase, hyaluronidase, protease, chondroitin sulfatase, endotoxins after attaching onto the tooth surface. These enzymes cause damage to the epithelial connective tissue cells and intercellular constituents, thereby widening the spaces between the junctional epithelial cells. This permits the injurious agents derived from the bacteria or the bacteria themselves to gain the access into the connective tissue. Now, the gap which is created between the cells also cause the microbial products to penetrate and activate the monocytes or macrophages to produce vasoactive substances such as prostaglandin E2, interferon, tumor necrosis factor, and interleukin 1. Now, when we see about the various stages of gingival diseases, there are four stages. Stage 1 is the initial lesion, which lasts for 2 to 4 days. Stage 2 is the early lesion, which comprises of next 4 to 7 days after the initial lesion. Stage 3 is the established lesion, which is from 14th day to 21st day of the disease. And stage 4 is the advanced lesion. As per se, when we talk about the cells which are predominant in these lesions, in the initial lesion, it's the polymorphonuclear leukocytes. In early lesion, it is lymphocytes, and in established lesions, it is plasma cells, which are the predominant immune cells of the lesion. Now, diagrammatically, when we see the initial lesion, we can see that the junctional epithelium is intact. In the early lesion, that is, once there is penetration of the neutrophils followed by the lymphocytes, there is apical migration of the junctional epithelium. In the established lesion, there is further penetration of the plasma cells and further collagen breakdown. And in the advanced lesion, there is apical migration of the junctional epithelium accompanied with the bone loss, which is the advanced lesion and comprises the stage of periodontitis. Now we'll see about the different stages, stage by stage. Stage 1 gingivitis, which is the initial lesion, it's the first manifestation of gingival inflammation characterized by dilated capillaries and increased blood flow. These initial inflammatory changes occur in response to microbial activation of resident leukocytes and the subsequent stimulation of endothelial cells. This is subclinical gingivitis, not apparent, and occurs in response to the bacterial plaque. The subtle changes can also be detected in the junctional epithelium and perivascular connective tissue at this early stage. The perivascular connective tissue matrix becomes altered and there is exudation and deposition of fibrin in the affected area. When we see microscopically, we see changes in the blood vessel morphological features, that is widening of the capillaries or venules. There is adherence of the neutrophils to the vessel walls. As you have seen, they are the predominant cells in the initial lesion. Occurs within 1 week and sometimes as early as 2 days after plaque has been allowed to accumulate. The leukocytes, which are PMNs, leave the capillaries by migrating through the walls, and they can be seen in increased quantity in the connective tissue, the junctional epithelium, and the gingival sulcus. Exudation of fluid from the gingival sulcus and extravascular proteins are present. Next is the stage 2 gingivitis or the early lesion. It involves the initial lesion within about 1 week after the beginning of plaque accumulation. The clinical signs involve erythema, bleeding on probing, which is the first sign or clinical sign of the gingivitis, is also seen here. The gingival fluid flow is increased and the number of transmigrating leukocytes also reach their maximum. The amount of collagen destruction increases, that is 70% of the collagen is destroyed. The main fiber groups affected appear to be the circular and the dentogingival fiber assemblies. Next is the stage 3 gingivitis, which is the established lesion. It is characterized by the predominance of the plasma cells and the B lymphocytes, creation of a small gingival pocket lined with the pocket epithelium. The B cells found in the established lesions are predominantly of the immunoglobulin G1 and G3 subclasses. In chronic gingivitis, which occurs 2 to 3 weeks after the beginning of plaque accumulation, the blood vessels become engorged and congested, venous return is impaired, and the blood flow becomes sluggish. This results in local gingival anoxemia, which superimposes a somewhat bluish hue on the reddened gingiva. The last of the stage is the advanced lesion, which is the stage 4. It is basically the extension of the lesion into the alveolar bone, characterizes the fourth stage, and it is a phase of periodontal breakdown. Microscopically, there is fibrosis of the gingiva and widespread manifestations of inflammatory and immunopathologic tissue damage. In general, at this advanced stage, plasma cells continue to dominate the connective tissues and neutrophils continue to dominate the junctional epithelium and the gingival crevice. Thus, we can conclude that knowledge about the cells involved in the lesion helps us to identify the stage of the disease and predicting the course of the disease. Thus, it is important to know about the inflammatory changes as it is a double sword mechanism. Thank you.